Good morning. My name is Jay Africa. I'm the Director of Behavioral Health in Marin County in California. I am also a NAMI California board member and have been so for a few years. It really is sort of a pleasure to introduce Danny Offer, who is the state lobbyist of NAMI National. Danny joined Platinum Advisors in 2011, has been NAMI's I would say foremost legislative advocate for the last 3 years, more than a decade of experience working for local governments, Alameda, Orange County, San Bernardino, San Francisco, and also Ventura. He's sort of an expert, often testifying to legislators, really to advocate some of the work that we are all pushing to really improve mental health services, not only in locally, but actually nationally. Danny is a family member and really knows, aside just from a professional background, really how mental health conditions touch our lives. So welcome, Danny, and we're really grateful that you are here. So take it away.
Thanks a lot, Dr. Africa, and I'm really happy to be here with all of you. So as Dr. Africa introduced, I'm Danny Offer. I'm with Platinum Advisors. We're your state lobbyists, essentially your eyes, your ears, and your voice in the state capitol. And it's my mission to elevate all of your voices into the laws that are being made in the state capitol, whether that means jumping in to amend bills that may overlook our loved ones, or whether it's to oppose bills that might negatively impact people living with a mental illness, but also crafting legislation to make life a little bit easier for our loved ones, safer, more productive, and healthier living in this state. As Dr. Africa noted, I am a family member as well as a consumer. Frankly, a lot of mental illness in my family. My aunt had schizophrenia, lived most of her life in a state hospital. Plenty of horror stories to share with her living there. My sister currently lives with a serious mental illness, and I spent most of my life living under agoraphobia since age 17. For those who aren't familiar with agoraphobia, that's essentially when your nervous system puts you on house arrest, and it's pretty much impossible to leave the house more than a mile without panic attacks sending you back home. I was lucky enough to finally find a medication that works for me, and can honestly say that the last 3 years have felt like the first time that I'm actually living a full life. And honestly, NAMI helped me a lot in overcoming the stigma that I lived with in my family, and knowing that, you know, you can always try again to find treatment and to find support, even if it hasn't worked before. My sister hasn't been as lucky. She's had multiple interactions with law enforcement. Fortunately, she's never ended up in jail, but she's been on multiple 5150s. And knowing all of this, it's been, you know, a nightmare for my family, but that's not even half of what I know a lot of you have gone through with your own family members. And I use that knowledge every day to motivate me to learn as much as I can about the system and work for all of you. Because if I'm not getting this right for my sister or for anyone else in my family, I know that I have to get it right for you all who have lived through similar nightmares yourselves. I just kind of wanted to give you all an update on what has happened in the Capitol this year. Just last week, Governor Gavin Newsom wrapped up his signings and vetoes of legislation. The legislature introduced a whopping 2,421 bills this year. Fortunately, NAMI doesn't have to take positions on all of those. However, we do read through all of them to see which bills will affect our loved ones. of those bills that were introduced, 836 reached the governor's desk, and he signed 770 of those, and he vetoed 66 of them. I just wanted to give an overview of the main bills that we worked on this year. We actually sponsored a number of bills this year. The first one I wanted to highlight is SB 224 by Senator Anthony Portantino. And this deals with mental health education for California students. Just to give you some quick numbers, 1 in 5 California youth currently live with a mental health challenge. That works out to approximately 1.8 million of our kids that might need mental health supports and services. And those numbers are even more dire for communities of color, as well as for our LGBTQ+ youth. For example, last year, 1 in 3 LGBTQ+ youth reported seriously considering suicide. 1 in 3. And as you can imagine, COVID has made all of this much, much worse. In January of 2021, 20% of the teens who came to UCSF Benioff Children's Hospital emergency room were suicidal. That's the highest percentage on record. In 2020, we lost 134 young Californians to suicide. In 2019, nearly half of youth who were severely impaired by depression did not receive treatment. And as we know, stigma is one of the major barriers to seeking help and can often cause multi-year delays. One study showed that for people who eventually receive treatment, the median delays ranged from, for mood disorders, 1 to 14 years. For substance use disorders, 6 to 18 years. And for anxiety disorders, that's 3 to 30 years. So knowing that mental health education can be one of the best ways to increase awareness and empower our kids to seek help, NAMI formed and led a coalition of youth advocacy organizations and mental health groups to sponsor legislation that would require middle and high schools that offer a health education class to include mental health education in the curriculum. This was probably our hardest fight in my time with NAMI. While we enjoyed a lot of support from dozens and dozens of organizations, we also went up against opposition from the California Teachers Association, which is one of the most powerful lobbying groups in California. Nobody makes more millions and millions of dollars in campaign contributions in California. And as I'm sure you know, money talks especially loud in the legislature. Contrast that to NAMI California, a nonprofit does not make any campaign contributions. So all we've got is our minds. When we started out at the beginning of the year, the bill was initially crafted to require mental health education in all schools. But we ran up against this opposition from the Teachers Association, and we were forced to take amendments to get a hearing in the Education Committee. So fortunately, we made great relationships with the California Department of Education, as well as consultants in the Education Committee, to work out amendments that limits the bill so that schools that offer a health course will be the only schools to teach mental health for the next 3 years. But during that time, we will then work with the Department of Education to expand this statewide. Unfortunately, you know, the sausage making of the legislature often waters bills down, but this means that it often just turns into the long game. And we are committed to working over the next 3 years with the Department of Education to make sure that this is expanded statewide. We also had to work with the governor's office on this. Once it got to his desk, we encountered opposition from the administration as well as the Department of Finance. They said, well, you know, we've already put all of this money into the state budget for children and youth behavioral health. to the tune of about $4 billion this year into the Children and Youth Behavioral Health Initiative. And they argued, how is this bill not redundant to that? So we had to go in and work with the governor's office and convince them that, you know, this bill is complementary to the state budget. You know, you can throw all the billions of dollars you want at mental health, but if you don't address stigma, if you don't get kids talking about mental health early and often, many of them won't ever feel comfortable or competent enough to seek help in the first place. So all that is to say that luckily the governor signed the bill 2 weeks ago, and it will take effect January 1 of 2022. Many new lobbyists think that the governor's signature is the end of the story, but that's often just part one. And part two will be us working with the administration, with the Department of Education, and many of these mental health groups to work on implementation of this over the next 3 years and to figure out what works best and how we can ultimately expand this statewide. The next bill we sponsored was AB 1065 by Assemblymember Brian Mainshine from San Diego. This bill is the Mental Health Crisis Prevention Voluntary Tax Contribution Fund. The problem we were trying to address here is another stat for you here. Nearly 1 in 4 people who were shot and killed by law enforcement in recent years had a mental illness. 1 in 4 people. So to address this, NAMI sponsored AB 1065, the Mental Health Crisis Program, which will create a voluntary tax contribution fund, which will fund programs that bring cops, mental health providers, individuals with mental illness and their families into the same training room to aid and improve law enforcement's response to people experiencing a mental health crisis. So far through this program, we've helped train over 10,000 law enforcement personnel in California. Now, if this sounds somewhat familiar to some of you, you will note that a few years ago, we had a similar voluntary contribution fund. However, one of the rules that the Franchise Tax Board throws in is that if you don't raise a certain amount each year, they strike you from the form. And this year we came just shy of the number of 250,000 and thus were struck from the form. Now, in normal times, that would be it. You don't get a second bite at the apple. But fortunately, we had a lot of help from one of our board members, Harold Turner from NAMI Urban LA. And we worked with the revenue and taxation committees and helped them see that the impacts that COVID has on nearly everything, not to mention charitable contributions, and we managed to re-up this program. But this $250,000 limit is why it's especially important that we all get the word out this year about this program. But I recognize that talking about tax forms might not be the greatest conversation starter when you're talking with your friends. So one thing I wanted to point you all to is a really great documentary on HBO called Ernie and Joe Crisis Cops. And it actually shows NAMI members in action in the training room with law enforcement, training them on just how to deal with a person who's in a mental health crisis, what it's like to be in a mental health crisis when you may be hearing voices that are all shouting at you. It's a very, very vivid image of just what this money goes towards. So rather than simply trying to get somebody to talk about their 540 tax form, I feel like that's a great starter. And I'll put the link up to the film in the chat box just so you all have access to that. I also wanted to touch on, I think that Angela discussed 988 in one of the last sessions, but stateside, we worked along with NAMI Contra Costa and the Miles Hall Foundation and others to sponsor legislation to enact 988 statewide. So essentially the state bill would establish within California, a 988 crisis hotline center, using the digits 988 to connect people experiencing a mental health crisis to the supports and services by way of the National Suicide Prevention Lifeline Network. And once this goes live in California, 988 would then connect callers with around-the-clock intervention that could include mobile crisis support teams staffed by mental health professionals, as well as trained peers. However, to adequately and sustainably fund this system, the feds have authorized us to impose a fee on phone lines for providing the services. And those funds can be spent on routing the calls to an appropriate crisis center, also on workforce, and also on mental health crisis outreach and stabilization. A lot of this is modeled after the cahoots model in Oregon, which was started back in 1989 in Eugene. And these teams, these mobile teams in the cahoots program, they have a crisis intervention worker who's trained in counseling and de-escalation, as well as a medic. And these teams address both the emotional and physical needs of a patient while alleviating the need for police and EMS involvement. In 32 years of operation, Cahoots has had 0 fatalities, which is pretty striking for that many years. And I'll put this also in the chat. NAMI did a great series called Help, Not Handcuffs. And in I believe it was part 2 of the series, they interviewed Ebony Morgan, the program coordinator from Cahoots. And she gave a great overview of that program. With 988, however, we met up against a formidable foe. As you may imagine, if anyone's going to oppose a fee on phone bills, it would be the California Cable and Telecommunications Association. So they came out saying, well, we support the idea, but we do oppose the fee. And of course, the fee isn't something we're really willing to negotiate on, since the fee is what would provide the services under the 988 program. So this bill has been turned into what's called a 2-year bill. If it gets to a certain point in the process where it stalls out in a committee, then you have to take it up again in the following year. So January comes around, we will need to get the bill out of the committee by the end of that month. So over the next few months, we'll be working this bill really hard, because whether the bill passes or not, 988 still goes live because of the federal law. So we need to make sure we get this right, and that the infrastructure is in place for this to roll out. Another thing we've been working on this year is developing white papers, which inform the legislature and also inform our lobbying on some of the bigger mental health policy areas. For example, one is the Lanterman-Petrus Short Act, also known as the LPS Act, also known as the 5150 law, which was crucial to California's deinstitutionalization of people living with mental illness. Today, the vast majority of people receiving mental health treatment do so at their own free will. But we know that the symptoms of serious mental illness can at times endanger people, making them unable to safely care for themselves. There's been a lot of bills over the last few years that deal with the LPS Act, and most of them have fizzled out. It's a really tough law to negotiate on, as there are many parties with opposing views on it. You try to strike a balance between getting humane help for people who need it and balancing civil liberties. The legislature is actually going to be holding an all-day hearing this coming December to discuss reform to the LPS Act. And NAMI California will be taking a large part in that. But with our white paper, we're calling on policymakers to ensure that the LPS Act assures people receive humane and timely care. A couple years ago, we conducted a survey of NAMI members, and we received over 1,300 responses, which is the most responses I've seen of any NAMI California survey in my time. So I'm really grateful for all of you who took the time to respond to that survey, because it helps inform our lobbying in the legislature, and to have those actual stories to offer up to legislators, it cuts through the process a whole lot more than a letter from up high might. And I just wanted to share with you a couple of the responses that we got, because I thought they were really, really poignant. One member said, "I have had my son detained twice under a 5150. The second time he was detained, it was agreed between myself, the PMRT team, and the on-staff psychiatrist that he needed to be detained for several weeks for evaluation. Nevertheless, at the end of the 72-hour hold, he was released on the grounds that the county had no psychiatric beds available." Another member said, "My daughter has been hospitalized several times under 5150, only to be released to the streets after the 72 hours was up. She has been in the homeless incarceration circle for 6 years. One particular experience is vivid in my mind. She was in a county dual diagnosis program and had an episode and ended up in the hospital. The psychiatrist met with her, my husband, and myself and told us he wouldn't release her until she had a place to stay. I called the next day and she had been given a bus pass and released." So, armed with this white paper and the survey results that we received from you all, NAMI's lobbying for the state to do a number of things. Number one, examine the adequacy of discharge requirements for places that release people held under LPS. We believe that people receiving hospital-based mental health treatment or crisis stabilization require a high level of wraparound and transitional services that they don't consistently receive today. Number two, we have to increase the availability of a variety of long-term care and permanent housing options for people living with mental illness. Number three, California must shorten the time between a psychiatric hospital discharge and a follow-up aftercare appointment. Currently, it can take as long as 9 days for people who have just been discharged from a psych hospital to be seen for follow-up care. And that's even longer if you live in a large county. It can take up to 15 days in a large urban county. The last thing I wanted to touch on is the Incompetent to Stand trial work group that we've just been recently on with the Department of State Hospitals. Just briefly, under state and federal law, anyone who has been charged with a crime must be deemed mentally competent to help in their defense. By definition, a person who's incompetent to stand trial lacks the mental competency required to participate in their court proceedings. If they are deemed incompetent to stand trial, they're then referred to a state hospital to be restored to competence, so they can then come back and participate in their trial. Now, a big problem here is we only have 5 state hospitals throughout a large state of 40 million people. And one of the big problems here is there's a long, long wait list to get from a jail into a bed in the state hospital. And California has had a long wait list for years. You can dive into the California Legislative Analyst's Office's reports. They go back all the way to 2012. They were trying to deal with this issue. Back in 2012, the wait list was 300 to 400 people waiting to get into a bed every month. By 2020, pre-pandemic, that list had grown to 800 people. And then under COVID, that number doubled. People can often wait up to 2 years to get a bed. And where do they wait to get a bed? They wait in a jail. where it's been well documented that people with mental illness are much more vulnerable to abuse. So Department of State Hospitals has called together a number of work groups after multiple attempts to decrease their wait list and multiple court rulings that have said, if you're going to have this wait list, people can't be waiting for years to get a bed. That goes against due process. So NAMI has been a part of these work groups to brainstorm some ideas on how we can fix this. And as many of you probably saw a few weeks ago, we sent out another survey to our members to get your feedback. And again, thank you to all of you who responded. And the responses we got were as unique as you may expect coming from family members and individuals with a mental illness. Some of them were positive. Some said it's the first time my son received the sustained medical care that he needed. Some said, you know, it was long, but it ultimately saved my son's life. Somehow they got him to recognize he had an illness and found a medication that worked for him. He's been on medication for over 5 years and is doing very well. You know, I mean, that's a best case scenario. You know, so many of us struggle with our family members and anosognosia, not being able to recognize that they have a mental illness. To hear that somebody goes into a state hospital and has that result personally gives me a lot of hope for my family member. But, you know, there were also many negative experiences reported. One member reported that after 4 months in an overcrowded rural out-of-state jail, it took family heroics to get him removed and transferred to a state-run hospital, mental health rehabilitation center for 10 months. And then finally, back to the assisted outpatient treatment program in Contra Costa County. Another member said there was no collaboration with our family who knows our child and his medical history best. So, you know, the main themes that came out of the survey was that the IST process feels cruel and exclusionary to many families who are seeking to support their loved ones and are met with bureaucracy, red tape, and a care system that feels impossible to navigate. So based on all of this, we are working on another letter and a white paper to the Department of State Hospitals, and we will be submitting our comments. And we will be sharing that with all of you once it has been finalized. I think I've been talking for quite a while now, so I will stop there. And Dr. Africa, if there are any questions.
Thank you so much, Danny. I really just sort of appreciate many of that information. Actually, taking lots of notes. I probably will follow up on you with some of these things, but lots of information. I mean, just over 2,000 bills introduced this year, 836 reached the governor, 770 signed. So, I mean, it's sort of just interesting about how we really sort of create policies that really affect obviously the 988 is a big one. The mental health education to California students. I mean, really, these are really, I would say, hopefully will create some better services to our family members and our loved ones. We do have quite a number of questions. So I wanted to take time to do that. First question, how can we get a copy of the LPS white paper?
I believe that will be posted on our blog or shared out via one of our newsletters. But I will double check on that and find out how that's going to be. But I feel like our blog would probably be the best place to look for it. But if you haven't signed up for NAMI California newsletters, I would highly recommend you do that, because I would assume it would also come out via the newsletter.
Which is connected to the next question. What websites should be reviewed on a regular basis? For example, the state organizations like DHES, Cal Mesa, Juvenile Justice Commission. So I guess they're asking, are there places and websites that most of our folks should be kind of paying attention to?
Yeah, I would highly recommend getting on the Department of Healthcare Services email list. They send out a lot of, every Friday, I believe, they send out an update, particularly for what's going on in the state with Medi-Cal reform and various grants that are available. In fact, I think they just put out a grant for mobile crisis response in counties. So there's always a lot of really good information on behavioral health from those. I mean, frankly, I would also make sure to follow our two local nonprofit newspapers, Capital Weekly and Cal Matters. They both are really good about doing mental health reporting, and Jocelyn Weiner in particular from Cal Matters usually does an article at least once every 2 weeks on behavioral health policy. So that's a good one to follow as well. Department of State Hospitals is another good one to watch. And I believe also the California Healthcare Foundation also often does webinars on behavioral health. So they're good to follow as well. I mean, that's a great idea. I should probably try working up a list, and I'll see if I can quickly share that with you all.
Yeah, it looks like that's an interest for folks just because of the many information that I think is just constantly coming out. And, you know, I'm on a few of those websites, and frankly, it's hard to just sort of keep up. Next question, how do NAMI affiliates inform and involve our members in advocacy and legislation? Can we do more than just asking them to contact their representatives?
Absolutely. You know, I think one thing I would really advocate for is to get as involved at the local level as you possibly can. Attend your Board of Supervisors meetings. If you can't attend those meetings, look at the agenda for your Board of Supervisors hearings every week or every 2 weeks, however often they meet, because oftentimes items that, you know, are pertaining to mental health in your community come up on those agendas, and they need to hear from us. Additionally, locally, each county has their Mental Health Services Act funding planning that they have to do every 3 years, and it's great to be involved in that. It can be daunting. I know, looking at the Sacramento MHSA plan that they released this year was probably, I think it was about 356 pages, something like that. And you get a month to review that before you submit your comments. But, you know, so much of the work is being done at the local level. But statewide, I would also really recommend that you get to know who your legislator is. You know, ask to meet with their staff members if you can. I think oftentimes folks tend to think that you have to meet with the boss, you have to meet with the legislator, but staff members oftentimes are the ones who know the issues better than their boss does, at least at the legislature level, and who specialize in certain fields. Each legislator has to have a staff member who focuses on healthcare. And sometimes we're lucky enough to have staffers who focus specifically on behavioral health. For example, Senator Susan Eggman from Stockton has 5 MSWs on her staff. So all of her staff members are very involved in behavioral health. And, you know, oftentimes some are more knowledgeable than others, but that's kind of our job, to be, you know, the teachers to the legislature and their staff members, to let them know what's going on in their district, what their district's needs are for behavioral health. You know, a lot of legislators really want to do work on mental health, but they kind of don't know where to start a lot of times. Many times they'll ask us, hey, do you got any bill ideas? So if any of you have any bill ideas too that you'd like to share, please feel free to share those with us, because legislators are always looking for more to do on mental health.
Yeah, and I want to just add, Danny, with what you said. Locally, there's, you know, you said the Mental Health Services Act sort of committees or plans, but there's also the mental health boards that really, I think, are a great opportunity, because that's actually a body that helps the local behavioral health kind of understand the needs and the community and the families, individuals, but also you can hear some of what's happening locally there in terms of the services. So that I just adding that. One person said, Thank you, Danny, for all that you do, for sharing your personal story. It's been a privilege partnering with you this year. Um, Another one is, can you tell us about what's coming in California regarding peer specialist certification?
So the Department of Healthcare Services is, I think they're about halfway through the process now of peer specialization. Earlier this year, they had a number of listening sessions where they invited stakeholders to come in and talk about what they believe the qualifications should be for peer providers, what training should look like. So they are working on kind of what they call the regulations now that the Department of Healthcare Services will have for peer providers. And I think the draft should be out shortly. So I'll make sure to alert NAMI leadership once the next update comes out. Again, that's another great reason to sign up for the DHCS Friday newsletters, because they always put out updates there as well.
Okay. Oh, great. Yeah. Those are, yeah, just so many, but DHCS lists are probably would be good. All right. Do you have any ideas regarding future or ongoing legislation, or if they do have some, how do they communicate those ideas to NAMI?
That is a good question. Normally we would send that through our community advocacy position, but I think I will have to double check with leadership on that, and I'll make sure that we get that out in our next newsletter, because we are very interested in getting more ideas for bills, because now is kind of the time that we have to start meeting with staff members of the legislature to hatch new ideas for legislation next year. Usually as soon as the governor signs bills, we then have to jump right back into the role of developing legislation so that it can be ready to go by January. And oftentimes it can take months just to, research ideas and what's worked and what hasn't, what bills have already been tried and what didn't work. So it often takes a lot more time than, even after my 5 years of doing this, it takes more time than is expected. So I'll chat with leadership about that and get out how we can connect on that.
Mm-hmm. Let's see. There's a comment here that I wanted to just share. Get involved with your local county mental health board or commission, as well as the county level MHSA steering or oversight committee. That there are actually many opportunities. I think the takeaway here is there's many places to be involved, depending on where you're at. I think the importance of NAMI, obviously being connected to the work that NAMI is doing, especially locally and then also statewide. Also paying attention, maybe getting more information by signing up for listservs and Cal Matters. I actually subscribe to them quite a bit and read many of the things that they're putting out. They are focused on behavioral health. California Healthcare Foundation, obviously, and then checking out the NAMI California website, I think is the key points here too. I don't see any more questions. Do you have any more? We're opening it up. We have till about noon, so maybe we can have a few more here or there. So if you have, please send it. But Danny, do you have more last maybe comments, thoughts as you're coming up, hearing some of the people's questions?
No, just that I will try to put together a list of, here are things to bookmark. Here are lists to sign up to get updates. I mean, I know that it's a lot. I do this full time, and you all do this voluntarily among all of your other responsibilities in life. So I know that it can be a lot to keep up with, but I believe that it's worth it. I believe that, in California, we have a lot of good people working on this complex system. but it's confusing. It's confusing for family members. It's confusing for consumers, but it's also confusing for the policymakers. And so it's really up to us to, we hammer the idea of sharing our stories so much, but it's because it's important. It's because it's important for legislators to understand what it's like to have to go through this, what it's like to be a family member, what it's like to be somebody living with a serious mental illness, because it can oftentimes feel very abstract to a legislator who's, just up there on the, in the Capitol, and they have 8 million priorities they're dealing with. They have the oil companies coming in at 10:45, and then they have, the ACLU coming in at 11:05, and they have to be able to understand what works for our families, and how they might make that actually go through this convoluted process.
Yeah, it is. It's a very, you said it sort of convoluted, probably is an understatement.
Yeah.
Super complex, and also trying to ensure that different perspectives are heard, right? Sometimes they're actually conflicting messages, right? Then what's being asked by one entity at 11 o'clock might be a total opposite of the one that comes at 11:25. So I think it's really important, but the stories are important. The perspectives are important to really, really make a good decision or make policy. So I don't see any more questions. I just want to say thank you all for joining us. We'll give you a few minutes to take back to your time so you can do whatever you want. Danny, really, you're just a strong advocate. Thank you for sharing your story. We definitely rely a lot on you and sort of your experience and your knowledge to really help move some of this work forward. If there, there is another thing here. Are you able to share your email or contact info?
Sure. It's DPO, as in Daniel Paul Offer, at platinumadvisors.com. Sorry, I think the chat has been disabled for this one. So, or maybe it's here.
Yeah.
Here it is. Sorry, I'll put it up in the chat here.
Yep. So
can you all see that? Okay.
Yep. There we go. So thank you again for that. And again, on behalf of NAMI California, thank you all for joining us. We'll see you on the next session. Again, please don't forget to fill out the evaluation. We really value your perspective and your comments, and we always want to do better. And really grateful that you're here, and have a good conference. See you later.